The Prevention of Blindness Society of Metropolitan Washington was founded in 1936 by May Voorhees and Dr. William Wilmer of the Wilmer Eye Institute at Johns Hopkins Hospital. They discovered that the community had no facilities for preventing blindness. Since then, we've worked to find ways to prevent the needless loss of sight and to help individuals make the best use of available sight. We're dedicated to improving and preserving sight through services, education, advocacy, and innovation. We're constantly striving to fulfill needs the community may have with regard to vision loss. We realize that many in need don't get regular eye care. We established programs with Georgetown University Hospital and the Washington National Eye Center to regularly examine low-income patients. We provide the eyeglasses they require free of charge. We would also like to establish an examining room in our eyeglasses clinic to allow volunteer ophthalmologists and residents a location to provide free eye care to indigent patients. We have a very good network of experts and we're known in the provider community. Our board and medical committee are made up of leaders in ophthalmology and social services that help us identify community needs. We have many contacts with social service organizations and schools to give us access to those requiring our services. Our leadership looks for needs related to detecting and treating vision loss in the community. We realize that the DC community, although rich in resources, didn't have enough low vision care, so the Low Vision Learning Center was established to offer a variety of programs and services for people with low vision, including examinations and personalized rehabilitation programs. We've established partnerships with community organizations to provide more opportunities for eye care and health information to the people who need it most. For our screening programs, we identify people who need eye care but often cannot afford it. For that reason, we partner with hospitals to provide ongoing eye clinics. There, volunteer ophthalmologists examine the patients, the hospitals provide treatment, and we provide free eyeglasses. We're a member of the National Eye Health Education Program of the National Eye Institute, National Institutes of Health. We've collaborated many times with the National Eye Institute. Through these vital programs and relationships, we've set a standard of excellence in serving a diverse clientele with a variety of programs. We determine where the need for our services exists. Our medical advisory committee consists of the chiefs of ophthalmology from all the area DC hospitals, as well as other community leaders who regularly review our programs for effectiveness. The committee often fine-tunes our established programs. Our leadership determines how many screening sessions we need to hold to accommodate our service area. We strive to reach new geographic areas and new individuals. We have an annual audit, and the work and operations of the organization receives constant oversight by our board. Many don't know that the Prevention of Blindness Society of Metropolitan Washington is an independent organization and not part of a larger national organization. We're entirely responsible for our program development and fundraising. In addition to the many programs and services we provide, many don't know that we also provide grants for research projects. These grants have assisted macular degeneration, glaucoma, and assistive technology research. POB also has 2 resale shops that help us raise funds to continue and expand our programs. POB was a pioneer in establishing a program for those with age-related macular degeneration, the Macular Degeneration Network, which assists those suffering with the eye disease through support groups, expert lectures, and publications. We also provide a monthly support network for Stargardt's patients, which affects younger individuals. We've attracted individuals from as far away as Alaska because ours is one of the few Stargardt's networks in the nation. POB's Children's Vision Screening Program screens 8,000 children annually, has a 99% accuracy rate, and has identified many children with vision problems. Our screeners have successfully worked with children with disabilities like autism, ADHD, and hearing impairments. Many of our screeners have advanced degrees in early childhood education. If a child with an identified vision problem has no medical insurance, we refer the child to one of our partners where they receive a free eye exam. Children with no medical insurance can also receive free eyeglasses through our eyeglasses program. Because of our effective follow-up, our return referral rate is more than 90%. We have wonderful programs that serve our community, but reaching those in need isn't always easy. With the Children's Screening Program, we follow up with more than 90% of those screened. It's more difficult with adults. Once adults say goodbye at a health fair, there's no guarantee that the contact information that we have for them is accurate. So a great challenge is helping adults with vision issues to get the assistance that they need. Thanks to advancing technology, there's new screening equipment to better detect diabetic retinopathy, macular degeneration, children's eye issues, and other eye diseases. New technology can cost tens of thousands of dollars, but would be very useful in our screening programs. With additional funds, we could afford the latest equipment to expand our programs. Like many cities, Washington, D.C. is rich in resources, but lacks low vision services. We established our Low Vision Learning Center for that reason. But we'd like to open additional centers to expand these services to other areas, as well as increase our outreach to those in need.